jump in later, you're certainly welcome to. But hi, everyone. I am Annalise Cothran. I'm the Executive Director of the American Institute of Dental Public Health. And I am also the co-facilitator of the LGBTQIA NRT, and Chloe Van Zant, who will also be tackling today's presentation. We'll kind of talk about that in just a moment. But I just want to say welcome and also thank you to the co-sponsors of this workshop today, CareQuest Institute, the Oral Health Progress and Equity Network, the American Dental Hygienists Association, APHA Oral Health, and AIDPH. So to start things off, there are no conflicts of interest that any panelists or presenters have today to disclose. And there are CEUs available for this workshop, so you can request those at the end. So stick around until the very end if you would like to have continuing education requests. So just a couple of housekeeping tips before we get started. Number one, please keep video and audio off during the panel discussion. We do have this set up as a meeting format, meaning everybody can join in because we do plan on having small group discussion through breakout rooms. But until those open, we're asking everybody to keep their audio and video muted. We also will have a small group discussion. We plan for every small group to have a facilitator. These are very informal small group discussions, but if we get a lot of people who would like to join in on the discussion, we may have to adjust facilitators. So just kind of keeping that in mind from the beginning. CEUs are available, and this session is being recorded, but not for the small groups. Just the panel discussion will be recorded and made available later. And lastly, we are requesting that everybody add their personal pronouns to their Zoom name, which is one of our best practices here for our work group. And so to do that, you can just hover over your box in Zoom, your video box. There should be 3 dots on the top right, and you can click rename to add your personal pronouns. So from here, I am going to throw it over to Chloe Van Zant.
And I think your slides can be shared in full screen mode. We still see the first slide. I wanted to say thank you so much, everyone, for being here. Again, my name is Chloe Van Zant. My pronouns are she, her. I'm a queer woman. I am the program manager at Virginia Health Catalyst, formerly Virginia Oral Health Coalition. I'm so looking forward to this webinar. Thank you so much for registering for it and for being open to learning more about the transgender community. So today we're going to talk about supportive and equitable healthcare for the transgender community, what that looks like, and specifically focused on oral health care. With us today, we have 3 brilliant panelists that will discuss specific clinical care considerations, how we can be certain we are offering affirming care, and we'll also talk through different barriers and solutions to equitable access to care. We know that teeth are teeth, but of course that's not the full story. Every patient brings their entire self to their appointment, and so we'll talk about specifically what that looks like for the transgender community. So today our webinar format, we're going to have panel discussion for about 45 to 50 minutes. During that time, please utilize the chat box. If you have specific questions for the panelists, please put those questions in the chat and Annalise and I will facilitate them. And please also feel free to use it for discussion. If you are just wanting to comment on something that you've heard, if it's new or interesting, or if you want to hear more about it, please include that as well. And then, as Annalise mentioned, after that, we will move into small group breakouts just to kind of dive a little bit more into what we all learned today. So I just wanted to offer a little bit of context to this webinar. So as Annalise mentioned, we co-lead a LGBTQIA+ group through the Oral Health Progress and Equity Network, which is a national organization of different oral health members, partners, allies that are really diving into the question of how can we improve oral health progress and make it more equitable for everyone. And so Our smaller group focused on LGBTQIA access started in 2020, and we had a few different goals of creating resources, one of which I'm going to share in the chat box, and then also including more people in the conversation. I think it's not uncommon for oral health providers and members of the oral health care team to not be familiar that there is a need to be an ally and that information and resources are needed to help them in that. And then also we offer a lot of advocacy information and support. As we know, the LGBTQIA community is often targeted through different policies at federal and state and community levels. And so we also have a strong advocacy piece. So the group started with a needs assessment at the end of 2020, and we sent out a survey and had over 200 survey responses from dentists, hygienists, all members of the care team. And I thought this was really interesting and just wanted to share that when we asked if individuals were comfortable working with non-heterosexual people, just different sexual orientations, a lot of people said extremely comfortable, very comfortable, not as many on the less comfortable side, which was great. But then when the next question was, how comfortable are you working with the gender diverse community? We really see that extremely and very kind of go down significantly, a lot more in the somewhat category, and then unfortunately a few in the not so comfortable and not at all comfortable categories. And so this was really the impetus for this webinar, and wanted to offer additional information and resources and just open this conversation that hopefully all oral health care providers can improve their level of comfort and be ready to offer equitable access to care. The other thing I'm going to add into the chat box is just a Trans 101 resource that talks about different terms about transgender individuals, talks about pronouns. And so if any of that is new or unfamiliar, please feel free to go through that website. Our conversation today will not be as focused on those specifics, but definitely want you to have that information at the ready. Thank you all.
Thanks so much, Chloe. And so we're going to go ahead and start the panel discussion. And I think where we'll start first, as I spotlight our panelists for today, is I'm going to stop sharing my screen so that everybody can see our panelists. I also want to just ask them first if they can introduce themselves and share their pronouns and a little bit about themselves, and then we can dive into the questions. As Chloe mentioned, please feel free to chat in questions throughout this panel. We have some planned questions, but we can certainly delve into the topics and discussion from our panelists. So we will start with Michael. Since you're the first on my screen, would you unmute and introduce yourself?
Hi, everyone. My name is Mikey Farmer. I use the pronouns he, him, his. I'm a general dentist in Charlotte, North Carolina, and own a private practice here. I'm a member of the Charlotte Transgender Healthcare Group, which is a collaboration of healthcare providers that aim to provide safe spaces for transgender patients through education, advocacy, and awareness of transgender issues. I'm also the president-elect of the Charlotte Dental Society and adjunct faculty at the University of North Carolina Adams School of Dentistry.
Well, thank you so much for being here today. I will move to Erika. Can you please introduce yourself?
Hello, everyone. My name is Erika Anderson. I'm a clinical psychologist for many years. I'm at the University of Southern I just put myself south. University of California, San Francisco. I went to USC. And I work in the Child and Adolescent Gender Center. So if any of you are pediatric dental professionals, I work with kids and families there and in my private practice with transgender people of all ages. I'm the president of the United States Professional Association for Transgender Health, which is the American affiliate of the World Professional Association for Transgender Health, of which I am a board member as well. And it's a pleasure to be with you. I will out myself. I am myself a transgender woman. My pronouns are she and her.
Wonderful. Thank you so much for being with us. Avery, would you like to introduce yourself?
Sure. Thank you, Annalise. My name is Avery Brown. I am currently the Senior Operations Project Analyst with Chase Bruxton Healthcare in Baltimore, Maryland. We are we're one of the oldest and largest FQHCs in the state of Maryland. We have always been focused on the LGBT community, healthcare. We've been providing dental services since, I believe, 1999, particularly to the LGBT population, but we provide it to all of our patients now. I use the pronouns they, them, theirs. I identify as a male to female trans individual, and I'm glad to be here. Thank you so much.
Thank you, Avery. So I think it's a good place to start with our first question, which all of you have noticed here today that we've introduced ourselves with our pronouns, and we're encouraging you to add your pronouns if you're willing and able to your Zoom name. And so I just want to ask, why are pronouns important and the use of pronouns in transgender patient care? And Erika, if it's okay, I'll start with you, and then we can head to Michael and then Avery.
Sure. Well, being gendered as we wish is very important to people whose gender is different than the sex they were assigned at birth, and it's in some cases it's a part of the first steps of coming out and being socially coming out socially in the gender that one has, and it's also significant because I think for a lot of trans people, gender non-binary people, we're nervous about how other people are going to treat us. And using the gender and the pronouns that we prefer is a sign to us of respect.
What about you, Michael? What would you add to that question?
For me, I think for transgender patients, the gender that they identify with is a very large part of their identity. So whenever you ask a patient what their pronouns are, and when you use those pronouns, you're showing the patient that you care for them and that you respect them as a human being. And I think it reassures them that they're accepted and that they're worthy of recognition. So you're going to build that trust with those patients. And one of the things we should point out is that transgender individuals suffer from a much higher rate of issues such as depression and suicide and other mental health issues. And one of the reasons for that is this unwillingness to recognize their gender identity. And if you show a willingness to use their preferred pronouns, it lets them know that you're accepted in your dental office. And so building that trust is key, as with any patient interaction, to be able to actually provide care to them and do it effectively. And also, I think your recognition of their pronouns sometimes will also open up their willingness to seek other types of medical care. So say you have a transgender patient who comes in the office and they have a really bad toothache and they haven't seen a dentist for years, and they may not have seen a medical professional for years or a mental health therapist for years because of a bad experience they had before. And you make an effort to say, hey, these are your pronouns. We recognize that, and we make an effort to use it. We make an effort to use your preferred name. Maybe that tells them, hey, maybe things are a little different nowadays, and maybe I should seek care that they may desperately need. Maybe that would open them up to being able to seek care with other medical professionals and say, okay, this place was okay. Do they have somebody that they know that they could refer me to? And then they get the medical care and the mental health that they need. And so it's not only about their oral health, it's about them as a human being, as well as their overall health.
Yeah, I like that. Thank you. Erika and Michael, I'm hearing both of you really emphasize the need for a whole person healthcare approach and how pronouns really fold into that. Avery, what else would you add about pronouns, particularly in just personal or healthcare spaces?
Sure. So I think one of the most important reasons why pronouns are so vitally important for our patients is sometimes this is the only space where they can be affirmed as their true, authentic self. I live in Baltimore, but we are by far not exceptionally unique here. A lot of our patients don't have supportive families. They don't have supportive friend groups. They don't have supportive jobs. they in fact may not have a job if they come out. And so I think it's very important that we as healthcare providers and people who work in healthcare really understand that we might be the only people affirming them. I know I had one incredibly kind doctor who asked me what my pronouns were, and that was the first time I felt like I could say it because I felt welcomed. And it took me another 10 years to say it again. But for the next 10 years, I had the best experiences with that doctor that I've ever had. So, and that's a personal experience. But I think if we can strive to always ask somebody's preferred pronouns and strive to make an effort to use them, it lets them know that they feel that they have a place they can come to. They have a place where they can be true to who they are.
Absolutely. And I want to hearken some of this back to what Chloe shared before, which was about the comfort level of providers. And Avery, it sounds like your experience with your provider they had a very sort of high level of knowledge and helped you feel comfortable in the healthcare process. And what we saw from that initial needs assessment was that, some people felt like they had a high level, a lot of people felt like that they had a low level of understanding the specific needs of the transgender community. But then we also had several responses in that survey that talked about how treating transgender people is sort of no different from treating anyone else. And it kind of reminded us of almost like a colorblind argument in that, oh, I just treat them like everybody. And I'm wondering what the panel feels like in terms of whether you would agree with that. If there are differences, can you explain why you think there are differences or why that approach is or is not helpful? And we'll switch it up and I'll start with Avery this time if you'd like to share your thoughts.
Sure. So I think that's sometimes a problematic approach only in that, to me, that kind of says that all trans people are the same and we're not. I very much present masculine most of the time professionally and in my home environment because I'm sort of I'm new to this part of the process. But I also, that's just how I'm comfortable. But I think there's a certain expectation that if you identify as a trans female, that you will dress in female clothing, and clothing, your appearance, your hair, everything about you is how people read what your gender is. And so if I'm wearing, more masculine clothing and I get misgendered because you're treating everyone as they are, then that's actually problematic for those patients. And you can be as caring and as conscious as possible and still do incredible harm when that happens. And to be honest, I've done it. I work at an LGBT clinic. I've misgendered someone because I looked too quickly. I didn't check the chart before I called them back. I've done the same thing. And I think that also does not give space to those providers who really try and make a mistake. We had an incident last week with a nurse who misgendered a patient, and she only did it once. The patient was fine. She came in the back and she cried for 45 minutes because she just couldn't believe that she had done that. She's worked with us for 20 years and it was just a rough day. There were other things going on. And so I think if you have that approach, it can sometimes be more difficult to provide that kind of space that people need. And from a medical perspective, and I can't speak a whole lot to it, I'm not a medical professional, but some of the medications that we take predisposes us to certain issues like bleeding more and things like that. And so if you approach me as a man, I actually take estrogen. I am more likely to bleed. And so if you're not really kind of asking those questions to every patient, regardless of how they're presenting, you're doing a disservice to the community that we're trying to serve.
Thank you so much for that, Erika. What do you think about the notion that, you would treat any transgender patient as you would any other patient?
Well, piggybacking off of one of Avery's comments, when you've seen one transgender person, you've seen one transgender person. And in addition to the individual differences that are enduring over many years or even a lifetime, many trans people are in the process of changing how they present in public. and undergoing, in some cases, medical interventions to do that, to assist with that. So they may actually be appearing differently over time. And so, looking at someone's head and face and hearing their voice is an insufficient way to conclude what all is going on with this person. And like pretty much everybody, there's a lot of misgendering that goes on. Some of it, as we know, is perhaps well-intended, but what we have to be aware of is that gendering is actually instinctive, that evolutionary psychology teaches us that after we see detect another human being in our visual sphere, we determine threat value. That we don't even think about it. It's the lower brain doing that. And then very quickly, we determine gender. It's just sort of hardwired into us because actually it's related to threat value historically. In most of our societies, female gendered people are perceived as less threatening than male gendered people. So we have to be careful that we have unconscious bias about gender, just as we have unconscious bias about race and other things. And it requires some effort. And as Avery points out, we don't always get it right. None of us always get it right, okay? Because we're gonna make assumptions and because we're gonna act on these instincts. So it's really important that you try to be respectful. And I think most trans people recognize that if they're not presenting in a stereotypically gendered way, that there's the possibility of some missteps, but kindness overcomes that almost always. If you're kind to someone and you're respectful, those of us who are gendered differently can overlook a lot.
Michael, how would you add to that conversation as a dentist and someone who routinely treats transgender people?
So first I would say, piggybacking on everyone else's conversation, from what I've learned from transgender patients, if you do, I've messed up, I've misgendered, I've used the wrong preferred name. And from my understanding, the best way to do it is to apologize and move on and not make a huge deal of it. They know you're trying. If you're putting forth the effort, it's an honest mistake. Address it and be concise and don't drag it out and make a big deal about it. They're okay. They know what you're doing. They know that you're trying, but do apologize and say that you're sorry and address the issue. Don't just avoid it. Looking at it from the dental perspective for the people who are here that are in the dental career, I'll say as far as the colorblind argument goes, I completely disagree with this because if you're a hygienist, are you going to treat the 4-year-old patient the same way as you're treating a 40-year-old patient? And I really hope not, because I do want to see that 40-year-old patient's face whenever you ask them to close on Mr. Thirsty and let them go to the treasure box. So personally, I don't treat any two patients the exact same. For some people, I need to educate them on oral health and explain to them why it's important and give them payment options and show them with models what the result's going to be. And for others, they walk in and they've broken a filling off a front tooth and they look at me and they say, I need it fixed. I need it fixed now. It doesn't matter what it costs. And I'm not going to address them the same way. I'll talk to them very differently. And I think it's the same with transgender and cisgender patients. And it's all about what you're saying to them and how you're treating them. In the end, sure, if you're doing a DO on number 18, it may be the same technique on two different people. But I'll tell you that most of my day is not actually doing the DO on 18. It's everything that leads up to it and everything after that. A transgender patient is going to automatically come in and they are going to be cautious about the level of acceptance that they have in your office. They're coming in, they're going to evaluate everything from how you talk to them on the phone, how you greet them when they arrive, what your patient forms are saying. Are you making an effort to call them by their preferred name, their preferred pronouns, how their gender is addressed? And all this happens before you ever walk in the room as a dentist or hygienist to see them. It's an entire office issue. And if you don't meet all those criteria, you're not going to be able to establish trust with that patient. And most likely they'll never come back and you won't be able to do that DO on 18 that you're probably much better at doing than I am. So I would say if you're pushing for a colorblind argument on treating these patients, that those people are really saying that what they're trying to do is to conform the care of transgender patients into our existing cisgender systems that we have right now. And in reality, it should be that the cisgender patients should be included in our systems that are designed for our transgender patients, and that our cisgender patients should be putting their preferred name and their preferred pronouns on the forms so that everybody's treated equally.
I like that.
Could I jump in again?
Please do, yes.
Yeah, so one of the things I want to point out is I spent a lot of time talking with transgender, non-binary young people and their parents. And a lot of trans people have the mistaken idea that someone else who knows them for many years can just flip a switch and use the preferred pronouns without exception, always correctly, all the time. And I point out the obvious, which is if you have a parent of a trans young person and they have had thousands of repetitions of using the name that was on the birth certificate and the pronouns that align with that sex as assigned at birth, they're going to require some effort and probably some relearning to overlearn the repetitions of the relationship to that point. So I encourage everybody to be forgiving, and if everyone is well-intentioned and kind, that goes a long way. But some parents are really good at it right away, and some aren't. And I suspect that some families who bring young people into the dental office screw up on their name and their pronouns, even being their parent when they bring them in. So we need to all kind of get along and recognize that there's a learning process and there's a relearning process that goes along with these things.
Yeah, and I'd like to add also, Annalise, that I think both of what you all have said is fantastic. And Mikey, I really like what you said, that we need to make everyone conform to the trans world. That's really what we try to do at our clinic. But what we run into oftentimes is the legal name of the patient is still what the insurance has. That's still what the medical records come in as. And so as much as we want to use pronouns, sometimes I see documents with the other name on it and I have to figure out who it's for because they don't always have it. And that's also very problematic for office staff who see hundreds of patients a day. In our clinic, we see about 3,000 a day across all 5 sites. When you're seeing 3,000 patients, it's harder to always be aware of those patients when you're trying to figure out who is this person I'm even looking at. And so I think it's also a systemic thing. We need to really make sure that the system is supporting these patients, because it doesn't always, or at all in some cases.
I think you're right. And leading into my next question, and I just want to give a shout out, if you have questions, you can enter them into the chat and I'm happy to moderate them. But I think all 3 of you have pointed out that there are a lot of barriers, potential barriers to transgender and gender diverse people feeling affirmed in the healthcare setting. And so I'm wondering, since we know that is a barrier to accessing care. So sometimes transgender people will not even go to seek out medically necessary care because of fear from discrimination or stigma, or just the exhausting process of having to come out again to another person. And so I'm wondering if you can share perspectives on how oral health clinicians, advocates, community members, et cetera, can really provide an inclusive and affirming environment. How can we as oral health equity advocates signal to transgender people that we are a safe or affirming person to provide care to them? And Avery, I'll start with you. Where are your thoughts on that?
Sure. So, I mean, it can be something as simple as wearing a button. Pride Month is easy because it seems like everyone has them right now. It can be as, I often start most of my conversations with patients, what are your preferred pronouns? I've never met you before. You're new to me. If I misgender you, please forgive me. I'm not doing it intentionally, depending on the situation. We also go so far as to say, understand that patient may have to work until 5 o'clock and cannot be at our clinic until 5:30. We close at 5. We'll open an appointment slot for that patient to be able to come in and get the care that they need, because we understand that, particularly if they're coming in for trans care of any kind, they may not be able to tell their employer why they need the time off. And a lot of employers require you to say what you're going to the doctor for. And you know, we will put notes into our patients and say, please use he, him pronouns, so they pop up as soon as you open the account. We note, you know, anytime somebody has an encounter and we've learned something, we try to always make sure it's visible for everyone else working so that it's not constantly re-outing. The patient doesn't have to re-out themselves every single visit.
That's helpful. Michael, how do you handle this in your practice?
So I'm going to speak from experience again from the dental side of things on this one. And I'm going to be completely honest. When I started my practice, it's about 7.5 years ago, I'd been exposed to very little education on transgender issues or the care for them. And throughout school and my associateships, I was never educated on any transgender issues. And so I took the initiative to learn from other healthcare providers in this area because there were no other resources at that time to address it. And I'm fortunate to have the Charlotte Transgender Healthcare Group that I'm a member of. And for a lot of people here, this may be your first exposure to transgender issues. And so I say, congratulations, you've taken the first step. Now it's up to you to continue that. And I'm proud of you for being here. Find the resources in your area and continue to get educated on the issues. For my practice in particular, the things that I've found to be successful are things that to us may seem like it's a small thing, but to them it's a very big deal. Some of the things, and this is kind of going back to what Avery said as far as systemic issues, that things that we need to address with our software managers, the big names in software management, the Dentrix, the EagleSofts, the Open Dental, and things that we need to be requiring are, you know, or if you just have regular paperwork, put a space on your paperwork for preferred name. That make that be the name that pops up when the patient's on the schedule or when the patient calls. Train your team to use those names every single time. And in a lot of the software now, you can have preferred names show up and not even have their given name show up, even though we need that for insurance. And provide a space for gender and make it a blank space that can be filled in. Don't just give 2 or 3 options. Let them write it in, how they identify it. Record this in their chart in their medical history. Put a space for pronouns and stick to using these pronouns. Avery had a great idea. Put a pop-up, you know, if it is. Also, you know, if you have a morning meeting and you need to gently remind everyone that day when you're going over patients, just these are the pronouns, like do that. I think that greatly helps a lot of people. And the next thing would be provide training to your staff, because your staff wants to know these things. They want to be educated on it. And they also need a place where they can ask the questions that they have to a person who's educating them, not to a patient who's sitting in the chair. Those patients aren't there to educate your staff. They're there to get dental treatment. So give your staff a safe place where the questions they do have, they can ask, they'll be answered by a medical professional, and they don't have to necessarily put a patient in an uncomfortable spot. And when you do the training, you know, trying to show the community that you are a safe place, post about it on your social media, put it in your newsletter to your patients, tell people about it. You know, you can say, we did Trans 101 or Gender 101 training today. I think that's very beneficial, and people will find it on social media. Connect with other medical professionals. This is what I did. You know, other medical professionals in your area that are treating transgender patients, ask them questions, show your interest in setting up an accepting office. They're going to share with their transgender patients, hey, there's this dentist who's really trying hard over there. If you need a dentist, you know, something's going on with your mouth, go see them. You can put, just like Avery said about the pins, get a safe space sticker and put it beside your front door with a transgender flag on it. One of the things that we did, have a booth at your local Pride event and talk to the people who are there. When I started my practice the first year, I set up a booth at Charlotte Pride. 100,000 people typically come through Charlotte Pride in 2 days. And couldn't tell you how many different people, just people walking the streets, come up to us and just said, thank you for being there. I've been to this Pride Festival for years and I've never seen another dentist here. and they'll ask you about the training that you do, and you can talk to them about the training with their staff, and you can also provide resources. Now we have the Charlotte Transgender Healthcare Group there, and we're telling them about providers and resources that are available. And you have so many people who come up, and just you being there is showing, hey, I support this community and we're a safe place for them to come. There's also certain LGBTQ plus directories, such as the Gay and Lesbian Medical Association, that you could sign up for. There's other ones that I'm sure the committee that we're working with right now, and they could have a great resource group. There's in the southern area, there's a lot of groups that are involved specifically in transit issues that can list you as a accepting provider. And then there's also local activities that may be involved with transgender LGBTQ plus issues, such as in Charlotte, we have a couple, one that'll help teenagers who may not be supported by their family or friends anymore. PFLAG's a great example of this. They have like 365 chapters around the country. So there's probably one near you, and they could provide support for your staff and also give you resources. And I'll tell you, if you're willing to make the effort and show that you're an accepting office, transgender community, especially the younger transgender community, tends to be one that's very close knit. They talk on social media, they talk in groups, and they communicate a lot. And if you treat, a few of the same people in that group well, and show that you're accepting area, they will tell their friends, and you'll really get a lot of experience at treating transgender patients.
Well, that was wonderful. I love all of the ideas that you mentioned. And Erika, I'm wondering if you can weigh in on this discussion, but also I'd like to bring up some questions that we have in the chat around pronoun usage. I know there was one comment about whether or not we should be using the phrase preferred pronouns, because we know that gender expression and identity gender identity is not a choice. We know there are biological components to gender identity. And so there was a question about that, and kind of along the same vein, asking patients about their pronouns. Sometimes people get upset. So maybe you ask a cisgender person about their pronouns, and they may have a negative reaction to that. So do you mind weighing in on, just about affirming care and how we can be affirming providers, but also thinking about those two comments on pronouns, how you would respond to them?
That's for me. So I'm mindful of the fact that I live in an area of privilege regarding LGBTQIA plus issues. I'm in a large university medical system. We have one of the customized versions of Epic, which is one of the predominant electronic medical records. We have ample applications that allow us to have a name other than birth name or legal name and preferred pronouns in our system. So I'm aware that many of you on this Zoom call are in areas of the country where you're not in a system that has an electronic medical record with such robust capability. The question is an interesting one about, and there are so many differences of view about how to do any of this, frankly. And I default back to being respectful. I think that we're in a period in our society in the USA where there are pitched positions about the culture wars about, I mean, literally in America, we still have people who think trans people should be erased. And we had government people who in the recent past acted upon that intention with very specific practices and policies. So there's no shortage of defensiveness. There's no shortage of sensitivities. And if we're all mindful of that, then we're going to be better off. And, I believe good intentions are important. I think good communication is important. Mikey gave a lot of great suggestions, and I don't have much to offer beyond that. I like the trans flags, by the way, behind you in your case, Annalise, and Avery was right about, it's Pride, happy Pride, it's Pride. the more these things become the common lexicon of how we talk with each other, the better off we are. And those who are uncomfortable maybe are only uncomfortable because they're ignorant or inexperienced. Some, I would dare to say, are uncomfortable because they have positions of their perspectives are contrary to those of radical inclusion and acceptance. And that's the point at which I am happy to get engaged in a discussion to point out to people that they could be better informed.
And Erika, I'm wondering if we can expand on that about being better informed, because I know you mentioned WPATH in the beginning. And this is really the standards of care for transgender care. And I am probably on the higher end in terms of understanding some of these technical perspectives about transgender care. But for people who are unfamiliar with that, I'm wondering if you could just talk a little bit about that. And I wonder if there are any WPATH standards that you're aware of that we could apply to the oral health community or oral health providers. But just maybe giving that resource and explaining what it is and how people can educate themselves about that would be helpful.
Sure. So WPATH.org is the website. You can go there. There's a lot of information available, including the standards of care, which are currently aging out in the 7th edition. The 8th edition of the standards of care are being polished and fine-tuned, and they'll be released later this year. I'm not aware of a lot of specific content in the standards that have to do with dental care or oral health. I'm pretty sure we do have some dental professionals as members. The predominant groups of members are medical and mental health professionals. There are some legal professionals and some voice professionals, and then a smidgen of various folks who just are interested and want to be supportive. But good suggestion. It's too late for this 8th edition, but maybe the 9th edition, which likely will be 5 to 10 years from now. Dental professionals could weigh in and offer their insights into how to provide comprehensive holistic care in your area.
Yeah, I would like to add, I have not heard of any either, Annalise. I know that we offer quite a few continuing education credit courses for medical professionals, nurses, and hygienists, but I actually don't think we offer anything specific to trans care for the dental patient, which is a problem given who we are. But so yeah, I haven't heard of anything either, but I'll definitely keep an eye out and forward whatever I can find.
Michael, do you have anything to add to that?
Going back to the question about asking cisgender patients their pronouns and making them uncomfortable, for me, I think Avery's experience with hearing that story where there was a medical professional who said, "What's your preferred pronouns?" and that was the first time that they got to say that and express that and then felt comfortable with getting that care. For me, that's worth making that cisgender patient feel uncomfortable with having to say, hey, my pronouns he, I go by he, and then making them feel weird about that. That's their issue. When we can make it better for someone in a medical way and make everyone feel equal. Again, it goes back to not having to make transgender patients fit into a cisgender model. What we should do is have cisgender patients fit into an accepting model for everyone.
So I was just going to say, in the trans community, we call that out and we say that's cisgender privilege.
I like it.
I was going to mention that too, but I think to me, okay, we're making a cisgendered person feel uncomfortable. How about all of the trans patients you have who feel uncomfortable when they're not asked the question? So I can throw it back, throw it right back at you. I've said it to a couple of patients who didn't know we were an LGBT health center, who were uncomfortable with the questions we were asking. And I said, yeah, but what about the people who are here? And I get a lot of positive feedback from doing that, but it's Baltimore.
Yeah, and that's encouraging to know that there are places, and I see a movement here in self-education and provider education about wanting to create inclusive and inviting spaces and inclusive of everyone, which I think maybe leads me to my last question here today before we consider moving into the breakout rooms to the next phase of the workshop, which is if you could leave, everybody here who's joining us today, if you could just leave them with one change that you think they could make, or one important truth that they should leave with for either personal or professional growth, what would you say? If maybe they didn't listen to anything else on this panel and this was the one thing, like this was the take home point, what would you say? And Erika, if it's okay, I'll start with you on that question.
Sure. So I do a lot of public speaking and some media work, and I hear all the time steady diet of people saying about someone that they've learned is trans or non-binary, oh, I just don't understand. I just don't understand. As though it's the obligation of others of us to help them understand. So here's what I say to that. It's not so important that you understand these are difficult things. It is important that you accept that this is what the person tells you about themselves.
I like that. Avery, what would you say? What would you leave people with in terms of the most important piece they could walk away from this panel?
That you might be that one individual that they're offering trust in to say something about themselves, and they may not have anybody else. And that's a very honored place to exist in. And so remember that.
That's wonderful. Michael, what would you say?
I totally agree with Erika. Be accepting and be open and make an effort. Educate yourself. One of the things that Avery mentioned was that there's not a lot of dental education. This is something that a group of us have been pushing for the last few years in the dental world. And what I think is there should be education at every dental school, every hygiene school, every assisting school, every dental conference, local dental meetings, online for people who are remote. It's an issue that'll make a big difference in patients' lives. Your team members want to learn this. You need to learn these things. It's an issue that we haven't addressed, and it's time to catch up with our medical colleagues who've been talking about this for years. And so make the effort to educate yourself, be accepting, and make the effort with patients, and that's all you can do.
Yeah, I think that's important. And while I have a little bit of moderator privilege, I'm going to say that what I would leave everybody with here today is encouraging, even if people have known them for a long time, encouraging the continued use of expressing your personal pronouns, because that can change. You can know somebody for a really long time and their personal pronouns may change. So I want to encourage all of us to keep the conversations open and continue dedication to inclusion and affirmation. And some of those pieces of information you can find in the link that Chloe put in earlier, which was for our one-pager that we developed for LGBTQIA+ advocates for the oral health community. And so you can find some of that there. And then I just wanted to, thank the panelists so much. I know I've personally learned so much from all of you, and I really, really appreciate the sharing of your lived experiences and the ability to be open and vulnerable and talk about these things that are critically important to oral health equity within our community. So thank you very much. And while we move to the breakout sessions, I also just want to share my screen, hopefully correctly this time, and just highlight one more resource, which is the Equality Act Toolkit that we put together for the oral health community. It is our understanding that they will be calling for a vote for the Equality Act here probably within the next couple of days. And so there's definitely still time to talk to your senators about passing the Equality Act. because we still need federal protections for LGBTQ+ people, and it has an impact on your overall health and well-being, and it's critically necessary for the oral health community to dive into these conversations and do the work and do the advocacy. So from here, I would like us to move into small group discussion. And I just want to reiterate, this is really informal discussion. This is really a time to sort of process what you've understood, ask questions of fellow attendees, and we have some conversation starters here. I'm going to open up the Zoom rooms, and I want everybody to give me just a minute of patience because we'll move facilitators into those breakout rooms. And you should have facilitators who are asking these 3 questions, but you can feel free to talk about whatever you'd like to. And so we'll go ahead and do that now. And close